All right, so today's December 16th, 2013. You're here for a 4-day ketamine infusion. Let's go over your history just a little bit, okay? Back in January, you suffered an injury to that right foot of yours, okay? There was no bones broken at that time. But what is important is that the pain spread from your foot up your leg to about your knee, okay? And they put eventually ended up putting a spinal stimulator in you. And we talked about in putting spinal stimulators in young people like you, it's a pretty risky thing to do because you're still growing. And the electrical contacts will change position, and then you have to have another one put in, and another one, and another one, okay? So we don't recommend that in children unless there's a really, really good reason. You hadn't had any lumbar sympathetic blocks, so when you came here, we told your parents, let's try the safe and simple thing first, right? And so we did a series, Dr. DeRossery and I did a series of 3 lumbar sympathetic blocks, and we actually got you into remission. Unfortunately, you had another injury. And this injury seems to really set this thing off really bad, okay, in that right lower extremity. Now, we also did some pain thresholds on you recently, and it looks like, although it seems like everything is localized to this leg, it looks like you've got it pretty much in the other leg and pretty much throughout your body. We call that generalized complex regional pain syndrome, okay? Now, the other thing we did here was a little bit of a concern is the fact that she had some liver enzyme elevations in the past, and we thought it would be a good idea to check to make sure they're not elevated anymore, and so we did a liver enzyme function test on you, and you're now normal. And our plan is when you go back to Mexico City, you're going to have those repeated just to make sure they're still normal, okay? All right?
Yes.
Now, are you ready to do some testing?
Mm-hmm.
All right, let's do the vertical finger test. 2 vertical fingers in your mouth. Are you having any pain in your face when you do that?
No.
Okay, very good. Now, the next thing I want you to do is take that right hand, sit up straight in the chair, like, got to sit up straight. Okay, that's good. Now, are you having any pain when you do that?
Yes.
And point to where you have it, right back in there, right? In the scapular area.
Yes.
Right. Now, take that right hand out in front of you, open and close it as fast as you can. You have any pain when you do that?
No.
All right, now do the left, please. Behind your head. Good girl. Good girl. You have any pain when you do that?
No.
So you only have it on the left side in the back.
Yes.
Take your left hand out in front of you, open and close as fast as you can. Now, the next thing we want to do here is draw your attention down to your leg, okay? Where the pain is the worst. And I want you to close your eyes here, Valentina, and I want you to start at your knee and work your way down with your eyes closed. With your eyes closed, no cheating. And when you get to the area that feels like road burn, when it starts to hurt really bad, then I want you to stop and I want to compare where our lines are. Go ahead. Real light stroking, very light. That's right. You're doing a good job. That's right. Light, that's right. Light strokes. Let me know when you get to the spot.
There.
Right there? Perfect. Very good. All right. So what we're going to be looking for is to have this shrink down so you can go all the way down to your toes, hopefully, when we're done. Okay? Now, the next thing we're going to do here is we want to get it so that you can put your right leg down, please. In fact, you can put both legs down, please. I want you to rotate as best you can that right foot. Can you do that for me as best you can? Can you rotate it?
No.
You can't move it. Okay. Try to wiggle your toes over there. Can you wiggle your toes at all?
No.
Okay, very good. So all we want you to do is just to try at this point. Now I want you to do the left leg. Take it off the ground. Rotate your ankle there as best you can. All the way around. Does it feel a little stiff or is it working okay for you?
Okay.
It's feeling okay. Wiggle your toes over here. Okay. Hitchhike back to Mexico City. Oh, you're going to make it. Oh, get it up there. Come on. You have any pain when you do that?
No.
All right. Now this is the tough part, so I want your dad to help me with this, and Mom also. I want you to get on either side of her. And I know that you can't put weight on that foot, but Dad, I want you to stand up there. Dad, I want you to stand up there. Safety. Safety number 1. I know you can't put weight on that foot, but I want you to, as best you can, show us what you can do right now, just once. How much pressure can you put down on the floor? Any at all?
No.
What does it feel like when you touch the floor?
It hurts.
It hurts. What does it feel? Sharp? Burning? What does it feel like?
Burning.
Burning? Okay, I understand. Now you can sit down. And by the way, Valentina, I notice you put your leg up, okay? And the reason you put your leg up is because it is less pain. Is that correct?
Yes.
Okay, very good. All right. Now let's get Mom back over here. Mom, Dad, move in close to her. Okay. All right, Dad. Okay. Now, I want to start with you. You tell us what life was like before January. Was she a very active girl? So you're the English speaker, huh? You're the translator, huh?
Yes.
Okay, go ahead.
Okay, she was a very active girl. She
Yeah.
used to practice dance. She used to dance jazz and hip hop before she has his injury on her right foot.
Okay. Okay. So she was very, very active.
Yes,
Right.
and she was very happy. She goes all around with friends.
Right. 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 Now, the other thing we talked about here is the fact she's 12 years old. And we, most kids we can treat with the blocks and get them better. But there's some, like her, that doesn't happen. So we go to the ketamine. So there isn't a lot of patients we have that we've done probably more than anybody else, but there aren't a lot. So you understand that we don't have a lot of patients we can compare her to, okay? So we're going to try to get as much objective information before we start on her, okay? Now, you've watched the 12-minute video, right?
Yes, with her.
Both of you.
Yes.
Either one of you have any questions at all about that? Anything?
Yes.
Please go ahead.
Okay, I want to know what can we expect after each treatment or after each infusions. For example, can she go out or have to lay down at home after the ketamine infusions, or what we can expect in her mood, or if she can tolerate something in her food, or whatever. You can comment about that.
Sure. Okay, first of all, you have to understand when we turn off the ketamine, it leaves the brain very, very, very fast. It's like they're in another world and all of a sudden, bang, they're back to planet Earth. Do you understand? The brain
Yes.
temporarily shuts down, okay?
Yes.
Now, for some people, that's a little uncomfortable. So we deliberately slow her down with a medication called midazolam. It slows it down so she doesn't wake up so fast. Okay, because it's uncomfortable waking up too fast. So we slow her down, okay? And so that most of the time, not everybody, they want to go back and take a nap for maybe an hour or maybe less, maybe 15 minutes.
Okay.
And then they want to go eat. Some people want to go eat because they haven't had anything after midnight, okay? But she'll be pretty much alert. We don't push them a lot into getting into heated pool exercises right away.
Okay.
That comes later, okay?
Okay.
We just don't want her to re-injure herself, okay?
Okay.
All right.
Okay, I have another question. What part of her short memories will she forget?
Well, all of that comes back. You understand
Okay.
that, right?
Okay.
All of that comes back. But we have to temporarily shut down her short-term memory. Ketamine does not work if it doesn't do that. Do you understand?
Yes.
So she may not be able to recall much information at all when you talk to her. But she'll be able to tell you what city she lives in. She'll be able to tell you her name, your name, that sort of thing. We've got 5 questions, what they talked about on the video, right?
Yes.
That we're going to ask her every 15 minutes because we want the long-term memory to be always there.
Okay.
That's how we keep her from getting too much ketamine. Okay? All right.
Okay. And the other question is, what can we expect after the 4-day infusions ketamine treatment?
Well, what we can expect, and what I expect, is her pain's going to go down. She's going to improve her muscle function, so she can now start moving that leg, which is critical to her rehabilitation. But the long-term benefits come from getting her into the heated pool exercises, which we're going to discuss in great, great detail on Saturday when you come back after the 4 days of ketamine infusions,
Okay.
4 hours each day.
Can we expect that she can go back to Mexico City walking?
I don't know. We're going to find out. Whatever it is, that's because that's why we take all these objective measurements before we do anything, because we want to find out what the truth is, and we're documenting just like we're doing right now.
Okay.
Okay?
Is there a probability that the syndrome sleeps forever after this treatment?
I can't tell you that. I do know that people who have it once sometimes will get it again from re-injury. That's a fact. Sorry, that's just a fact. Okay? So for the first 6 months, she has to be careful not to re-injure herself. That's the most common reason why patients relapse, is re-injury. Okay? But if she can get through a rehab program for 6 months, then she can afford to do more risk-taking with her exercises. Okay?
Okay.
All right.
I think Valentina have a question.
Do you have a question?
Yes.
Okay.
The pain will slow down like in the sympathetic block, like in the first one it go a little bit less and less
Right.
and less, or it will be like until the fourth
Yeah.
infusion.
Each day, I expect your pain to get less and less. But it's important to understand, sometimes it takes 2 or 3 days to really kick in. Most of the time, it kicks in on the first day. So that's why I pay attention at the end rather than look at it. Now, if you're into horse racing, dog racing, then you probably want to watch the scores. Because remember, we're taking pain thresholds every day.
Okay.
Okay? Any more questions?
Yes. I do.
Okay? Any more questions?
No.
Okay, very good.
I do.
Okay. Mom just raised her hand.
What we have to do if she has another injury?
Well, that depends on the circumstances. A lot of times, I'm going to give you some information before you leave. I'm going to give you some information on how to best determine if she needs another ketamine infusion, okay?
Okay.
But we want to treat, but we don't want to over-treat,
Of course.
okay? Now, I think it's really, really important, and there's no charge for this, if somehow you can find a way to come back in about 1 or 2 months so we can repeat the measurements on her. That's really important, okay? And maybe you have questions, when you come back,
All right.
okay? How about you, Dad? Do you have any questions?
No, it's okay.
It's okay? Okay, very good. All right.
Okay.
Valentina, today is December 20th. Bente.
Eh?
Today, hoy,
Eh?
December 20. Dos, cero, uno, tres. ¿Sí?
¿Qué?
Que hoy es 20 de diciembre.
¿Qué?
Get over here because you're going to do some testing. Mom,
What?
come over here. Get over there.
What?
Okay, listen. Your mom's going to ask you a question. Mama, come over here. She's been on 135 now for almost 2 hours, okay? Milligrams per minute, okay? Mom, ask her 2 of those questions, those long-term memory questions.
What's your mother's name?
Claudia.
Good. And what's your father's name?
José Ramón.
Good.
Very good. Now, you know Karen? Over here. Karen. You see Karen?
Hi.
Hi.
I have a question for you, okay? Can I ask you a question?
Apagaste el volumen un poco.
Yeah, turn the sound down.
Pregunta? Una pregunta para tú.
Jesus, I'm impressed. Karen's speaking Spanish.
I don't know if it's right. Um,
Look over here at Karen. Karen's got you. She wants you to ask a question.
hi.
Hi.
There are 3 fish in the pond out there.
Hmm?
Tres? I don't know.
Peces.
Peces.
¿Qué?
There are 3 fish. Do you know how many fish there are? Tres pesas.
Mom, you ask the question, okay, in Spanish. Tell her, just say you're gonna. Can I ask you a question, okay?
In English or Spanish?
In Spanish. Can you ask her a question?
Te voy a hacer una pregunta. ¿Te puedo hacer una pregunta?
What?
Afuera, en el estanque, en la pecera, hay 3 peces. 3 peces. ¿Te puedo hacer una pregunta?
¿Qué?
¿Cuántos peces hay afuera?
3.
You got it.
I don't know. I can't. I don't follow the Spanish.
Yes,
Okay,
you got it.
All right. So here, let me see. Look at my finger up here. Look up. Look up there. Come on, look up there.
Look at your finger.
Look at
Al
my.
dedo, arriba, aquí.
¿Qué?
Mira arriba.
Yeah.
Aquí,
That's
arriba.
it. That's it. Good.
Allá, mira
Oh,
mi dedo.
Yeah.
Ahora para acá,
Yeah. Over here.
acá. Sigue mi dedo.
Yeah. She's
Ajá.
got the nystagmus. That's good. Yeah. Perfecto. All right. Now listen, importante. You ready? You
¿Estás
ready?
lista?
You ready? Valentina,
What?
show me the sign. All right, good job. Okay, Valentina, it's now the 21st of December, 2013, and there's only 4 more days to Christmas, okay? Right? And what we want to do is we want to first talk about how things went during the 4-day ketamine infusion, okay?
Okay.
We got you up to 135 milligrams of ketamine per hour. And we held you up there, I think it was for almost 2 hours at times, you know. So we gave her a good dose. What limited us in going higher in your dose was what? What limited us from going higher? Do you remember? What was that?
Because I go like to salivation.
Oh no, not so much. Yeah, well, you get this. We'll talk about the salivation. Yeah, you do. Kids will salivate with ketamine a lot more than adults do, and it's uncomfortable. Okay, feels like somebody's sticking their finger in the back of your mouth, right? Mm-hmm. Now, what happened is because I didn't expect you to remember. That was not a good question because you're knocked out. You know what would limit us is you get too deep. You were too far gone. Okay, so we had to bring you back to earth a little bit. Okay, by measuring your cognitive function. So that was the thing that limited us. Your vital signs were very stable. You didn't have any nausea or vomiting. In fact, one of the things that happened here, which we find very common in children, but not so much in adults, is she got high on ketamine. Do you remember that?
Yes.
Yeah. Everything's funny, right? Right? Okay. Those are important things to remember, and we have to treat the saliva with a drug called glycopyrrolate, or it's also known as Robenol, because it is very uncomfortable. So we have to keep your mouth kind of on the dry side. Okay. Now, but other than that, you did very well. Okay. Now there was one other thing that's true for adults as well as children, and that is when they get done with the ketamine, don't let them gulp too much water too fast, because it can trigger a reflex, and you can, it's not that you're vomiting; it just feels like you're gagging. Okay. All right. Now, you ready to do some testing?
Yes.
Let's do it. Okay. 2 vertical fingers in your mouth, please. All right. Now, let me see. Yeah. Any pain in your face? All right, good. Now, next we're going to have you put that right hand behind your head. Any pain when you do that?
No.
All right, very good. Now, put the right hand out in front of you. Open and close it as fast as you can. Good. Now, I think she had a little bit of shoulder pain when we started, okay? We talked about the idea that she has not been very active, right?
Right.
And so therefore it's going to take a while for her to get back to exercising and building up the muscles. That's not so much RSD, it's just the muscles are out of shape there in her shoulder area, okay? Put that left hand behind your head. There you go. Any pain when you do that?
No.
Okay, take that hand out in front of you, open and close as fast as you can. Right. Okay. Now, the next thing we want you to do here, do you remember we have these marks on you where you have this so-called allodynia, real sensitive skin. You remember that?
Yes.
I want you to close your eyes and don't cheat. I want you to take your hand, very lightly stroke, go down, and see if you find any more of that really, really, really sensitive skin that you had before. Go as far as you can. No mas?
No.
No more? Okay, so that's all gone. Okay, all right. Now, the next thing we're going to do, if you want to put your legs down, that a girl. Rotate. Remember, you could not move that foot. You could not move your toes. You could do anything down there. Now let's see if you can rotate your ankle for me. That's it. You couldn't do that before, could you?
No.
Do you have any pain when you do that?
No.
Wiggle your toes for me. Okay? Hitchhike back to Mexico City. Come on, come on. You did it before. You can't go. You got to stay here in Florida. You cannot go. Okay, so let's do the left side. Rotate. Very good. Now, did you have any pain when you rotated your ankle on that right side? Okay, very good. Now, this is the part where we're going to challenge you a little bit more. I want Dad, for safety, I want them to stand on both sides of you. And remember, you could not put any weight at all on that foot when we started. Do you remember that?
Yes.
Let's see if you can put any weight on it now. See if you can take a couple of small steps here. That's it. And the reason why it's so difficult is because you have not been putting any weight. It's going to take you a while to build that muscles and those bones back up again. You can go ahead and sit down. Did you have any pain when you did that?
No.
Okay, very good. Sit down. Now, we told you that the name of the game here in going forward with you is the heated pull exercises. You understand?
Yes.
We can improve on your ability to walk with that. It's going to take, it's going to take 4, 5, even possibly 6 months to build those muscles back up, the bones and the skin. It's going to take a while to do that, okay?
Yes.
And but it can be done, and it will be done with the heated pull exercises 3 times a week, as she can tolerate. No more than 30 minutes each time. In Fahrenheit, she's going to get the temperature of the water between 80 and 84 degrees, right?
Right.
Now, so we said that a third reason why the heated pull exercise is a good idea is because you're less likely. What?
Stress?
What?
Stress.
What's the word?
Stress.
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 Oh, stress. Oh, stress. You're getting ahead of me. Oh, you're getting ahead of me. No, it's that you're least likely to re-injure yourself with the heated pull exercise. The first reason, she needs the buoyancy because she can't do weight bearing right now, exercises. The second reason we gave is it's a desensitizer, keeps the skin from coming back and becoming sensitive again. The third thing is it's an exercise she can do where she's least likely to re-injure herself, okay? Now, and yes, stress. Good or bad?
Neutral.
Neutral. Good girl. Good girl. All right. So it's a normal biological response, right? And the physical activity of the water exercise is the most reliable way to control or to keep the stress under control, right?
Right.
So when you get angry and so forth, you're going to take it out on the water, right?
Yes.
All right. I've also suggested it's always a good idea when working with children to get a good clinical psychologist, not a psychiatrist so much, but a good clinical psychologist that deals with kids to help them manage a lot of those things that come with being young and being a young person, okay? So we talked about that as well. Now, okay, so let's say you get in the water and you'll say you exercise for 10 minutes, okay?
Yes.
And you get out of the water and you have no pain.
That's bad
It's bad, that's right, but why is that?
because I don't do like a lot to help me.
That's right, you didn't do enough, right? And you know that you got to get these good hangovers, which isn't the same thing as the RSD pain. You have to feel sore because you will not make the progress that you want unless you are. Now, if you get out of the water and you're laid up for 1, 2, or 3 days, that's a bad hangover, right, Mom?
Yes,
Yeah,
bad.
that's not good. No bueno. Okay, so you need to get the heated pull exercises in such a way that you get what we call good hangovers. Okay, all right. Now, we also said that when you're in the water, we're gonna measure something that's called exercise tolerance, right, Dad? Right. So each day, each week, you're going to look to see that you're improving on the amount of time you spend in the water. If you want to spend more than 3 days a week, more than 30 minutes each day, then you're going to have to spend more than 3 days a week. But 3 days a week in the water is a good idea. Okay?
Okay.
All right. Now, so the next thing we talked about is the medications, okay? We said there's a role for the narcotics, the opioids in treating RSD if she's re-injured. And if she has to go to the dentist, they really numb her down really good because the problem with these patients is if they don't get adequate pain control, they can set off the RSD, right?
Yes.
Okay, all right. So why don't you tell us in English and then you can tell us in Spanish, okay? What's this experience been like to you? Just kind of tell us generally what it's like. Was it scary? Was it...
The first days I don't like it because I remember how it felt and it don't feel like funny. Well, sometimes yes, sometimes no. Like the salivation is too uncomfortable.
Yeah.
But the next 2 days I don't remember like so well, so I like it better with no remember it.
Right. So towards the end it became more like a party, is that right?
Yes.
Yeah, okay. And your brother, he's 15 and you're what, you're 12?
Yes.
So he wants you to bring some ketamine back for him, right? So tell us what you just said. See if you can explain that in Spanish to us, okay? About what it was like. About
Que era más cómodo cuando no recordaba las cosas, porque cuando las recordaba me recordaba cómo se sentía la saliva y cómo sentía incómodo.
Okay, very good. I don't know what she said, but it sounded okay to me. Okay, so our first goal was to get your pain down and improve your muscle function. We've done that. The second thing is to get you in the heated pull exercise. That's priority number 2. And the last thing is to work with the medication, okay? And we said that, you know, she's not on any narcotics now, but if she gets injured, you know what they say, SH, right?
Yes.
What's that stand for?
What?
SH.
No, you are the doctor. Tell us. You know the answer, doctor.
Well, I do. It
Yes.
stands for stuff happens.
Stuff happens. Yes, you're right.
And so stuff happens, you know, she may need to have her pain controlled, okay? And that's really important for injuries and things like that, okay? Well, let's see if there's any questions. Dad, do you have any questions at this
No.
point? Okay. How about you? Do you have any questions?
No.
All right. And Mom, do you have any questions?
No, we're okay.
Okay, good. Oh, one other thing. Yeah, I want to make sure. We'd like to use this for educational purposes for other young people. Are you okay with that?
Yes, we're okay. Are you okay, Valentina?
Valentina, are you okay with that?
Yes.
Okay. And Dad, are you okay?
Fine.
Okay, very good. Okay, Valentina, today is January 31, 2014. And your last ketamine infusion was about 6 weeks ago, right, Dad?
Yes.
6 weeks ago.
Yes.
And we just did your pain thresholds, and they've actually improved from where they were when we finished the ketamine infusion on you. And we said the reason for that is probably because she's been doing the heated pull exercises 2 to 3 times a week.
Yes.
Also, she understands that now she's ready to start doing, if she wants to, the elliptical type of exercise, okay? And we also said that she has to be careful about re-injuring herself. As a matter of fact, about a week ago, approximately 5 days ago, you injured your, I think you had a fall, I think you said, and you injured your tailbone, okay? And then you had another injury a couple of days ago, and we said 2 things about that. Number one, that could reactivate your RSD, but it didn't, because we know you're still good. And it also lets you know that you don't have to worry every time, because she does not live in a bubble, right?
Right.
And we said SH, which stands for stuff happens.
Okay.
Why are you laughing? You know too much English, don't you? Okay, so let's go through these exercises for documentation purposes. Are you ready?
Yes.
Okay, so go ahead and put 2 vertical fingers in your mouth, please. Any pain when you do that?
No.
Okay, take that right hand, put it behind your head. No pain?
No.
All right, left hand behind your head. No pain?
No.
Okay, good. Take the right hand out in front of you, open and close as fast as you can. Any pain?
No.
Okay, left hand, same thing. Very good, excellent. Now I want you to go down here. You remember we marked you out here where you had it before, where you had the sensitive skin. Bring your leg out this way a little bit so we can see it better. That's it. Just bring it. That's it. Go see if you can go down there and see if you still have that sensitive skin. Go ahead. Close your eyes. You have that any more of that sensitive skin down there?
No.
It's all gone, huh? Go all the way down to your toes. That a girl. Good job. So that's all gone. That's good. Now, the next thing we want you to do, and then Dad's going to stand by your side, okay? Dad, go up there, and I want you to take 3 steps forward. Okay, and then you're going to take 3 steps back, okay? Are you ready? Okay, you're doing it already. Okay, go back. Don't turn around. Go back, back. Did you have any pain when you did that?
No.
Remember when we first did you 6 weeks ago, you couldn't walk. You couldn't put any weight on that foot at all, could you? Okay. Now, the next thing, I want you to hold your dad's hand, but don't use them unless you need them. Do you understand, Valentino? Okay, go ahead. All right, now see if you can take 3 steps forward on your toes. That's 1, 2, 3, and then 3 steps back. Okay? All right. Now, I want to tell you something. You're not ready for becoming a ballerina. You understand? You got to build yourself back up yet. Okay. Did you have any pain when you did that?
No.
Okay. Now do your heels, please. On your heels. Atta girl. 3 steps forward and 3 steps back, please. Good. Again, did you have any pain when you did that?
No.
Okay. Dad, sit down over here. Now we got one more exercise we want you to do, okay? This is the real test. Are you ready for the big test?
Yes.
I want you to take, you see that stretcher over there? That bed, that stretcher, that black thing. You see that? Okay, here, Valentina, here's what I want you to do. I want you to leap from where you are to that stretcher. Can you do that? Leap? No, you gotta fly. You gotta fly. Okay, have a seat. Have a seat. Okay, there you go. Now the reason you got that cushion is because you fell on your tailbone, right?
Yes.
Yeah. Okay. I think that's gonna get better with just a little bit of time. Okay. All right. Now, Dad, do you have anything to say about anything that you've noticed about? Is she feeling more upbeat now? Is she more happy? Is she contento?
Yes.
Más contento?
Yes, más contento.
And the family, más contento?
Very good.
Okay, good. Anything else you want? Any questions? Anything else you want to ask me?
No, she have a question in the your
Only
skin.
that I put like creams and it's still that.
You put cream on there?
Yes, and it's still being like
It's more dry, no?
yes.
Yeah. Is that where the original injury? Is that where you were injured?
Yes.
Yeah. I would not worry about that right now. I think that's going to get better with just the exercise. Do you understand?
Yes, and the other day I noticed that I have like veins.
You have what?
Veins, my veins.
Yeah, veins. Yeah, that'll get better too. That'll all improve with your exercise, right? And again, I want to emphasize that when we finished the ketamine infusion on her, everything was improved. Her movement and her pain thresholds were all better. But she's even better today, even though she's had 2 injuries since then. Everything is better than it was.
Yes.
And I think she deserves a lot of credit for exercising because that's what makes the difference, right?
All right.
Now, Valentino, do you have any questions at all about anything?
No.
Okay, very good. Excellent.